Hi, my name is Dr. Joel Collins, clinical haematologist, practice principal of the Iron Infusion Clinic. I often get asked, what is the difference between iron deficiency and anemia? It's a really good question, and they're often commonly confused, even sometimes amongst my colleagues who are health practitioners. So anemia specifically refers to a person's haemoglobin. That is, haemoglobin is the molecule that is red, makes our red blood red, and carries our oxygen. Anemia specifically refers to a person who has low haemoglobin, similar to a low red blood count. Anemia has many causes, including bleeding, various deficiencies, perhaps their bone marrow is not working, whereas iron deficiency is one of the particular causes of anemia. Now, iron deficiency refers to the state where your iron stores are low, and if a patient is to look at their blood tests, they will see a particular measure called ferritin. Ferritin is a storage protein, and it measures our iron stores. Now, ferritin being less than 30 micrograms per litre, at that point, everybody would be considered iron deficient under current guidelines. However, we know that adult males need to keep their ferritin, or generally do keep their ferritin, I should say, between about 1 and 200, and there's no really good reason why women and children shouldn't run ferritins as good as men. Certainly, women need ferritin iron stores more than men owing to menstrual losses in pregnancy. So iron deficiency is one of the causes of anemia. Iron is very important for making hemoglobin, or the red blood component, but iron is also required for a huge number of other functions in the body, including maintaining muscles, nerve growth, neurotransmitters, and brain function. And that is why a person can be iron deficient but not be anemic and still have a number of symptoms. We call that non-anemic iron deficiency, or iron deficiency without anemia. And that is a really important point, because some practitioners still are not aware that we should be fixing iron deficiency without anemia as well as iron deficiency with anemia. So that's why at the Iron Infusion Clinic, which is driven by a clinical haematologist, that is a blood specialist, and I train all of our staff, we actually take an end-to-end, very holistic approach as to why are you anemic if you are anemic, why you're iron deficient, and really get to the bottom of what's happening, how we can fix it best for you, and how ideally we could prevent this from happening again, or at least mitigate the need for having so much iron long term.